It's Etch, back with another health highlight from Michigan Primary Care Partners and Y102. This week, let's tackle aging. Something that our parents are going through, something that we're starting to go through. I'm pushing 40 here, and I can already start to feel the effects in my joints and in my back if I sleep just wrong. And there's lots of different remedies out there, topical things that you can put on. There's always prescription medication that we can go on. And there's also some of the homeopathic type of things that we can utilize, right? Well, let's tackle something that is a little bit more new to what we understand, and that's stem cell replacement. It's something that's a treatment that is apparently working well to repair damage to the spine and to the joints. And as we age, those cells start to break down. And that's where a brand new influx is. As those degenerating cells are happening, those new cells that are injected in can really do a lot of great things for that. Now, this is something that isn't necessarily new, but something that is being tested and researched and studied. And it's a great deal to be able to have in the toolbox against aging. Now, the doctor this week is going to take you through the process for each treatment and also how the regeneration process works and what kind of stem cells are used in the process. So let's check that out with this week's Health Highlights with Michigan Primary Care Partners and Y102.
And we start aging, our degenerative process takes over. And so our cells all over our body degenerate and lose and they age. And some of these things cause us problems. For example, our joints, our cartilage wore out, and then we were looking for some solution because it hurts. Because the stem cells are not able to reach to these areas in the right kind of concentration and not able to reverse the process of degeneration, because the regeneration has to be faster than the degeneration. So what therapies are being done is that you actually go to these areas where you have the stem cell present, and then you harvest them in the sense that you concentrate them. You can now concentrate them to the point that it can be 50, 100 times more stem cells in the same amount of, or a million times more in the same amount of fraction. And then you can inject that highly concentrated tissue with stem cells into the knee joints or the hip joints or the spinal joints or the discs. And now this high concentration of stem cells have a potential to regenerate into that particular part. What initial data has shown quite promising that some of the stem cells actually are able to transfer into those tissue. Adult stem cells are used and more treatment are being done, and adult stem cells are used for regeneration of the hair loss. They have been injected into the heart for the dead heart muscles. Excellent new data is coming up, new research is coming up, so it's quite promising as we look toward the future. It's one of the modalities, therapies, which we should not overlook and put that on the table for the right patient.